Hospitals are preparing for a surge in patients, and they're very worried about staff capability and capacity.
Tonight, the rapid rise in COVID-19 cases has hospital officials worried they could hit their breaking point. More cases means more people in the hospital. That is starting to put a bigger strain on the system than we have seen all year. There are now a record 264 COVID-19 patients in the hospital in Erie County, another 73 in the rest of Western New York. Both are the highest we have seen the entire pandemic. Tonight, Nikki Dementri takes an in-depth look at the challenges these numbers are putting on local hospitals.
Those are the highest recorded totals ever.
Those record totals, 316 neighbors fighting COVID-19 in Western New York hospitals, 264 of them right here in Erie County.
And we just keep going about as we're doing now. This is what we can expect to see. It's an exponential growth in the number of hospital admission, and it could far surpass what our capacity is.
This is what could be with or without a lockdown.
The issue is, do we as a community act in such a way tomorrow that we put more people at risk?
County officials say hospitals are preparing for the surge. Staffing, though, is their main concern.
Those on the front line, they're tired. They're dedicated, they're hardworking, but they're tired. We've, again, been focused on taking care of those employees, making sure that they're healthy and safe.
A Kaleida Health spokesperson says the hospital system learned from the first wave. It is now focused on personnel, space, equipment, and testing. Right now, 140 patients are fighting COVID-19 out of 1,000 inpatient beds.
For us, it's really a day-by-day, hour-by-hour look at this thing.
Can the community pull together to turn these numbers around? Do you think that's possible right now?
Oh, of course it's possible. It's just resolve, will, and really thinking of community ahead of oneself.
UB infectious diseases expert Dr. Thomas Russo shares in concerns and is asking the community to hunker down for the winter.
And be rigorous about following the public health measures that we know works and is really the only way we can prevent infections until we get to the vaccine.
The state is preparing a winter plan, which will prioritize zones with the highest infection and hospitalization rates. Nikki Dementri, 7 Eyewitness News.